Okay, this is the final video for health assessment. These are the blank sheets here. As you can see, they are all blank. Not a word on these things. Okay. Blank as can be. All right. So, my name is Joe, and I'm going to be the nurse practitioner assessing you today.
Okay.
And what's your name?
Elizabeth.
Elizabeth, what brings you in here today?
Physical.
Okay, just like an annual physical?
Yeah.
Okay. Well, first I'm going to start off by just assessing your mental status.
Okay.
Okay, so I'm going to ask you a few questions, and then eventually we'll do like a review of systems, which is just asking about family history and other questions like that, and then we'll finally move on to the physical exam,
Okay.
which will be the upper and lower body.
Okay.
So first, you told me your name. What is the time and date today?
It is December 6th, 9 p.m.
Okay, good. And do you know where you're at right now?
I am at your doctor's office.
Okay. I'm going to test just a little bit of memory here. What did you eat for breakfast this morning?
I had a bagel.
Bagel. And what did you do on your last birthday?
I was in Kentucky for a wedding.
Okay. Now, can you count backward from 100 by 7?
Yes. 100, 93, 86, 79.
Good. I know, it can be difficult sometimes. And can you explain the phrase, don't count your chickens before they hatch?
That basically means don't count on something before it actually happens.
Okay, good. The last little test here is I'm going to tell you 3 words.
Okay.
I have you repeat them, and then later on in the exam, I'm going to have you repeat those same 3 words.
Okay.
Okay? Apple,
Apple,
table,
table,
chair.
chair. Apple, table, chair.
Good.
Okay.
All right. Now we're going to just focus on just your past medical history. First, like in general, how do you feel your health is?
I feel like I'm in really good health.
Okay. What about any past surgeries?
No. Well, I had a mole removed here when I was in high school, so quite some time ago.
Oh, okay. So
But
high school.
otherwise, no other
Okay.
surgeries.
Any like traumas?
No.
Past hospitalizations?
Nope.
Okay. And what about medication-wise? Do you take any prescription medications at home?
No, I do not.
Okay. And what about over-the-counter or like herbal remedies?
I mean, I'll take Tylenol every now and then for like headache every, so often. But otherwise, no.
Okay. And allergies? Are you allergic to any medications?
No.
What about animals? Anything like that?
Cats. I get like really itchy eyes.
Do you have any like throat swelling or difficulty breathing?
No.
Or
No.
okay. Any seasonal allergies?
No.
Okay. And what about immunizations? Are they all up to date?
Yes, and I just got my flu shot for the year.
Oh, okay, good. Okay, now some questions on family history. Do you have any family history of cardiac disease? Any?
No.
No.
Cardiac.
No heart attacks, nothing like that?
No.
Okay. What about gastrointestinal? Any stomach issues, family history of that?
One of my first cousins, she has Crohn's.
Okay. All right. And what about lung? Any lung disease in the...
My mom's father, so my grandfather, passed away from non-smokers' lung cancer.
Okay.
Yeah.
That's it?
Mm-hmm.
All right. Any renal
No.
family history?
No.
What about musculoskeletal?
No.
Okay. Endocrine?
My dad's mom, she had type 2 diabetes when she was older.
Okay. What about neurological?
No.
Any psychiatric history in the family?
Say anxiety runs. It's pretty prevalent in my family.
And does anyone take medications or see a psychiatrist for that?
Not that I know of.
Okay. Okay. And what about any histories of like cancers in the family?
My mom's mom, she passed away from ovarian cancer. So yeah, the ovarian cancer and then the non-smokers lung cancer.
Okay. Okay, so I'm going to ask you a few questions. Psychosocial history, so that just pertains to, what are what do you do for a living, and are you in school?
Yes, I'm a pediatric nurse at Rainbow Babies, downtown main campus.
Okay.
I've been there for a little bit over 4 years now. And then I'm also in school right now. I'm getting my pediatric NP at Kent.
Oh, I know someone very well who's in that program too.
Yeah. Do they like it?
Yeah, they love it. Okay. What about any hobbies? I know you're busy with school and it must be stressful. Do you do anything to like alleviate that stress?
Yes. I don't have a whole lot of free time, but when I do, I like to stay active. I enjoy working out, going on runs. I have a lot of friends in the area, so occasional happy hour. And yeah, I like to keep busy.
Good. Do you have a good support system? What's your family life like?
Oh yeah, very close family. I'm one of 5. I have a twin brother. I live downtown, but my parents live close to me, so I'm frequently at their place.
Oh,
so yeah.
Good. So strong support system, close family. Good. So moving in the opposite direction here. So health risk factors. Do you smoke cigarettes?
No.
Do you drink alcohol?
Just socially, I'll have go out for happy hour and have like 2 glasses of wine.
Okay.
Once, maybe twice a week.
Okay. Any environmental risk factors like at work?
No, I'm pretty good about gowning and gloving when I have to. Don't see any huge risks for me.
Okay. And sexuality. Are you sexually active?
I'm in a serious relationship right now, so yes.
Okay. Do you use protection regularly?
Yes.
Okay. Any history of STDs or anything like that?
No.
Okay. And you said in general, you feel like you're in good health. Now, what about like energy level? Do you feel like you're tired excessively? Anything like that?
No, I would say for the most part I have a lot of energy.
Okay.
I live off of Starbucks.
Okay. What about any like fevers, chills?
No.
Do you have a regular sleeping pattern? Do you sleep okay?
Yeah, I sleep well at night.
Okay. And skin-wise, like, have you noticed any abnormal like lesions or bumps, bruising, rashes?
No.
No.
Nothing like that.
Okay. Head. Do you notice that your hair is everything fine? No excess dryness in the skin.
Yeah.
Do you notice any dizziness or fainting or anything like that?
No.
Okay. Eyes. How's your vision?
I've always had 20/20 vision. I have no problems seeing.
Okay. Any blurriness?
No.
Any pain in the eyes? No. Good. Ears? Any pain? Any ringing?
No.
No. Nothing abnormal?
No.
Okay. Nose and sinuses. Do you have any frequent nosebleeds? Runny nose?
I'm just getting over a cold, but other than that, no.
Okay. Mouth and throat. Do you have any pain swallowing?
No.
Do you have any lesions or bleeding of the gums?
No.
Sore tongue?
Nope.
Teeth. Do you regularly see a dentist?
Yeah. About every 6 months or so, I'm
Okay.
due for a visit.
Okay. And then neck and thyroid. Do you ever notice like any large masses on your neck, goiter?
No.
Any pain when you turn your neck?
No.
Okay. Respiratory. Do you have any trouble breathing? Shortness of breath?
No.
Nothing like that. cardiovascular, any murmurs or palpitations?
No.
Do you have any chest pain ever?
No.
Do you remember ever getting an EKG?
Once, but that was back in high school, and it was normal.
Okay. So really quick, back to respiratory. Do you ever notice any like excess coughing or sputum or bloody sputum or
No,
nothing like that? Okay. All right. Gastrointestinal. Do you have any nausea or vomiting?
No.
Any constipation? Trouble using the bathroom?
No.
Nothing like that. Okay. Genitourinary. Do you ever experience incontinence?
No.
Or okay, and frequency, is it? Would you say fairly normal?
Yeah, I would say normal.
Doesn't really like impact your day, like
No.
focused around going to the
No.
bathroom. Okay. Any painful urination?
No.
And female reproductive. When's the last time you've seen a gynecologist?
Last year, so I'm due for my next visit coming up.
And you said, I think I asked you this before, no STDs or
No.
anything like that. Okay. And is your menses regular?
Yes.
So no excess bleeding or okay. Any history of pregnancies?
No.
Breasts? Do you regularly check yourself? Any lumps
Yeah,
noted
I've
or?
never noticed anything.
Okay.
Yeah.
No discharge, no pain.
No.
Okay. And neurological. Do you have any like any tingling in the extremities or painful like sharp pains?
No.
Any seizures?
No.
Nothing like that.
No.
Musculoskeletal. Any painful or redness of the joints?
No.
Do you feel like your range of motion's okay? Can you move
Oh yeah.
everything without pain?
Yeah.
Okay. And endocrine, any like temperature fluctuations? Like,
No.
can you handle heat and cold
Oh, yeah.
okay? And any like weight gain or weight
No.
loss?
No.
Okay. And then you said psychiatric. Would you say any like major mood swings or hallucinations, delusions? Nothing.
I'm a pretty happy person.
Okay, good. All right, well, this part of the exam's over, so I'm going to now focus on the physical exam. Okay? I'm going to start with your head and work my way down. Okay, so we'll do the upper and then lower body.
Okay.
I'm just going to get your vital signs really quick.
Okay.
Just grab your blood pressure and pulse and respirations, okay?
Okay.
Okay. Let's grab your pulse. Okay. Now I'm going to just start with, like I said, I'm going to start with the head and
Okay.
just look at your skin, hair distribution. I'm just going to feel everything symmetrical. There's I don't see any rashes or abnormal skin discoloration. Your scalp, there's no excess dryness, no abnormal indentation. Everything looks pretty normal. Okay. Now I'm just going to do a few tests here, okay? I'm going to have you puff out your cheeks, okay, and frown for me. Can't really frown, it's okay. And go ahead and smile, okay, which you've been doing this entire time. I'm going to take a soft object first, okay, and I'm going to test for just sensation on your face in 3 different spots on both sides, and you tell me when you feel it, okay? And just close your eyes while I'm doing it.
Okay.
Right.
Now. 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 Now.
Okay. Now with those same spots, I'm going to test dull and sharp, okay? So this is, just to give you some point of reference, this is dull,
Okay.
and then this is sharp,
Okay.
okay? So just tell me when you feel dull and sharp.
Okay. Dull. Sharp. Dull. 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 Sharp. Sharp.
Good. Okay. Next, I'm going to be looking at your eyes.
Okay.
Okay. First thing, I'm just gonna be looking at, see if there's any normal discharge. Everything looks pink. Everything looks good. And you said you've noticed no change in vision or anything like that, or any pain. Okay. I'm gonna have you actually follow my finger. Okay. Just with your eyes.
Okay.
Okay, good. I'm going to be looking at your pupils. I'm going to shut off the light really quick.
Okay.
Okay? Just look straight forward for me.
Okay.
Okay. And I am going to get a close-up view here. Okay? Just look straight forward for me, okay? Okay. All right. Everything looks good. Turn the light back on. Okay, I'm gonna also check your peripheral here. Okay? I'm gonna wiggle my fingers and you tell me when you can see them. Okay?
No.
Okay, good. Let's see. Next area I'm gonna be looking at is your ears. Okay? To see if there's any pain or anything. No. I don't see any discharge or redness. Okay. I'm gonna have you tell me when you hear, or if you hear, me rubbing my. I'm gonna be rubbing my fingers.
Okay.
And you just tell me if you hear it. Okay.
Okay. Yeah. Yes.
Okay. I'm gonna check inside your ears. Okay.
Okay. Sorry, very ticklish.
That's okay. A lot of people are. Okay. Great tympanic membrane. Can you turn your head a little bit that way? Thanks. All right. Good. Okay. Next, I'm going to do something called a Weber test.
Okay.
And I'm gonna strike this tuning fork, and it's gonna create like a vibration sense.
Okay.
I'll place it on top of your head here,
Okay.
and you tell me if you can hear it equally on both sides.
Okay.
Okay.
Yes.
Okay. The next test I'm going to do is the Rhine test. Okay.
Okay.
I'm going to place this tuning fork right behind your ear here. Okay. And you tell me when you don't
Stop.
hear it.
Okay.
And I'm going to place it right next to your ear, and you tell me when you don't hear it.
Okay.
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 All right. Do the same thing on this side.
Okay. Okay.
All right. Now I'm going to be just looking at your nose here.
Okay.
Okay. You said no nosebleeds, nothing like that. Okay. Any trouble breathing?
No.
Okay. Just gonna be checking inside.
Okay.
All right. Okay. It's fine there. And the next area I'm going to focus on is just your mouth. Okay. Now, no bleeding, no pain, nothing. Your teeth, you haven't noticed anything as far as decay or anything like that?
No.
Okay. Can you open your mouth for me?
Okay.
Actually, grab this pen light right here. Open your mouth for me. Okay. And say ah. All right. Can you press your tongue against my hand here? Okay. All right. And can you clench down? Okay. Okay. Next thing I'm gonna have you do is actually turn to the side here for a second. I'm just gonna feel if I feel any thyroid. Take a swallow.
Okay.
Okay. No. I'm gonna look at and feel your lymph nodes. Okay. And just for the purpose of this exam, I'm gonna say them out loud.
Okay.
Okay. So this is the posterior auricular, preauricular, occipital, tonsillar, submandibular, submental, deep cervical, posterior cervical, superficial cervical, and supraclavicular. Okay? Can you shrug your shoulders against resistance? All right, and then turn your head that way and that way. Okay. And I'm going to do it without resistance too. Can you just look up, down, and side to side? Okay. Now I'm going to focus on I'm going to focus on your anterior or your posterior chest.
Okay.
Okay. And I'm going to first have you take a deep breath in.
Okay.
Go ahead. All right. That's symmetrical. I'm going to percuss. All right. I'm going to listen to those same spots. Let's have you take a deep breath every time that you feel a stethoscope touch your back, okay?
Okay.
And I'm going to check for tactile fremitus, okay? So every time you feel my hands on your back, just say 99, okay?
Okay. 99, 99, 99, 99.
Okay. Okay, and I'm going to do the same thing on the front here, okay? First, I'm going to have you take a deep breath in. Okay, symmetrical. I'm going to do the same percussion here. Okay, and I'm going to do the test for tactile fremitus again.
Okay.
So when you feel my hands, just say 99.
Okay. 99, 99, 99.
Okay. All right. All right, and then I'm just going to have you take a deep breath, okay? And can you just move your arm up a little bit? Yeah, go ahead. Take a deep breath. Okay. Good. Okay, the next thing I'm going to do is look at your. Oh, I'm going to check your heart and listen to some heart sounds. And I'm going to eventually have you lay on your left side, but we'll have you sitting up first, okay?
Okay.
I'm going to listen to each heart sound with both sides of the stethoscope, okay?
Okay.
Okay. I'm just going to feel this area of your heart right here. You said no pain, no shortness of breath,
No.
no abnormal beats or anything. Okay. Okay. I'm going to have you lay down. Have you lay down on your back.
Okay.
And I'm going to listen to those same heart sounds. All right, I'm going to have you lay on your left side there. Okay. Okay. Next thing I have you do is actually lay on your back. Oh, sorry.
Oh, it's
sorry. I should have you just stay on your back, and I'm going to check your abdomen. Okay. All right. First thing I'm going to do is just overall, I'm going to just inspect the overall appearance. Okay. And then I'm going to listen to the 4 quadrants here. Okay. I'm going to just feel. I'm going to percuss actually, just in various spots in your abdomen. Okay. I'm also going to listen to your abdominal aorta, renal arteries, liver, spleen. Now I'm going to attempt to measure your liver, okay? Which is on the right side. give it about maybe 4 or 5 centimeters.
Okay.
Okay. I'm gonna do some. Can you actually lay your legs flat for a second? I'm just gonna do some light palpation. Okay.
Okay.
No pain or tenderness.
No.
Okay. All right, and then bring your legs back up for me. I'm gonna just do some deeper palpation. Still no pain, no tenderness. Okay, I'm just gonna feel the abdominal aorta. Okay. Okay, the next area of the exam, I'm going to actually have you sit back up. And I'm just looking at your upper extremity, so your hands and your arms here. You said there's no painfulness in the joints, nothing like that, right?
No.
Okay. I don't see any swelling or redness, right?
Mm-hmm.
Okay. I'm going to have you just follow my lead, okay? I'm going to test for range of motion here. So I'm going to have you first raise your arm.
Both?
Just one at a time. Yep. Down, side, like this. Then touch it like that. There you go. And like this. There you go. And then across. Okay. And the same with this arm. Up, down, and then out. Like this. Across. That's right here. Right here. Uh-huh. Okay. I'm going to do that against resistance too.
Oh,
okay. So I'm going to have you push up. Okay. Push down. Push to the side. Oh, you're strong. All right. Push up. To the side.
Oh,
This way.
Sorry.
Push up. Sorry. This way and down. Good. Now range of motion of like your wrists and fingers, just up, down, side, side, against resistance, up, down, side, side, like this. Yeah, turn it in. Okay. And then fingers, can I just have you open and close? Good. I'm gonna have you open it like this. Okay, and same with that one. All right, and then against resistance, open, and then close. Okay, and open, close. All right, good. I'm going to test some reflexes. Now first here, okay. Knees. And your Achilles. All right, and then the next thing I'm going to do is, I'm going to look at your lymph nodes here. I actually have, I'm not supposed to really be able to feel these, but just checking. I think these are called your epitrochlear lymph nodes. Okay. Okay. Then the next thing I'm going to have you do is I'll check for the range of motion in your lower extremities.
Okay.
So I'll first have you just lay on your back.
Oh, okay.
Okay. I'm going to have you straighten out your legs. Okay. All right. No pain, nothing like that. Okay, and then I'm going to have you push against resistance, okay, and try to straighten. All right, push against resistance and try to straighten. And then going this way.
Oh, against resistance.
No, sorry, not against resistance. Okay, and then can you grab your knee to your chest? Or just one at a time.
Oh.
Sorry. Okay, and then that one. All right, good. And then sit back on the edge of the table for me. Okay, I'm gonna do. Where's my tool here? Where is that thing? Oh. I'm gonna do the test sensation too on both upper and lower extremities. Okay, I'm just gonna do it at random points here. First, I'm gonna do soft, and I'll do the sharp and dull.
Okay.
Okay, so just close your eyes again, and you just tell me when you feel it.
Okay.
Okay.
Now. 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 Now.
Okay, and now I'll do the sharp and dull.
Okay.
Okay, close your eyes again.
Dull. Dull. Sharp. Dull. Sharp. Dull.
Good. Okay. I'm going to have you. Oh, I'm going to have you take your heel and place it on top of your shin here, and just try to go straight down like this.
Okay.
Yep. Okay, and do on this side too. All right, and I'm going to check for. Oh, actually, I have to have you take your shoes off.
Oh, I'm sorry.
It's okay. And your socks too. Okay, I'm going to do something called the Babinski reflex, okay? That tickles, right? Okay, and then test for clonus. Okay, then I'm going to do another test here, and I'm going to use the tuning fork, which I used earlier.
Okay.
And I'm going to strike the fork, and you're going to tell me if you can feel it on multiple areas on both your finger pads and the pads of your toes, okay?
Okay.
Just close your eyes, okay. Tell me if you feel this.
Yes. Yes.
All right.
Yes. Yes.
All right. I'm also going to test for something called proprioception.
Okay.
And I'm going to have you close your eyes again, and I'm going to grab your fingers and your toes, and I'm going to pull them up or down, and you tell me which direction it's going in, okay? So really quick. So this will be up, this will be down. Okay? All right.
Up, down, up, up, down, up.
Right.
Up, down, down, up.
Okay. I'm gonna check sensate, or I'm gonna check something with it's called a monofilament,
Okay.
and typically people with diabetes, they have trouble feeling in their extremities.
Okay.
But I think based on your health history, you should be okay. You just tell me when you feel this monofilament touch the bottom of your feet, okay?
Now. No. 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 Now. Now. Now.
No. Okay. I'm going to have you stand up off the table, and I'm going to have you close your eyes, okay? And it's called the Romberg test, and just see if you can hold that position while closing your eyes, okay? All right, good. Now I'm going to have you walk So just look at your gait, look at your walk. Just walk back and
Okay.
forth normal. Good. I'm going to have you walk on your tiptoes, back and forth. And I'm going to have you walk on your heels back and forth. Good. Okay. Now I have you. Oh, actually, sit back on the table for me.
Oh,
Sorry.
okay.
And then have you take your index finger
Okay.
and touch your nose and then touch my finger
Okay.
a couple times here. Okay, good. I'm going to have you do rapid alternating movements.
Okay.
Just go like this with your hands. Okay, good. That was earlier. I just forgot that. Sorry. And I'm trying to think if I have anything else for you to do. Oh, I should probably feel for your pulses. Which I don't think I did earlier. So feel on the top of your foot, your dorsalis pedis here. Right, all are at least 2+ here. Okay. And what, did I forget anything else for you to do? Think I think that's it for my final exam.
Thank you.
So yeah, that's it. I hope so.